What's up everybody? Dr. Rossi, shrinksandSneakers.com. So before I start the video, I want to ask you guys who haven't done so already to like and subscribe to the channel. It helps me to keep making these videos. And because I love listening to your comments and the feedback about what works for you and what doesn't, as well as what topics you want to hear about, we're going to be covering a medication called Buspirone or Buspar by popular request. And I'm going to go over all the details on that medication here in this video. So Buspar has been around for a long time. In fact, it's been around for over 20 years. It was FDA approved in 2000. It was initially developed as an antipsychotic, which I think very few people actually know that fact, but it was originally developed to treat things like schizophrenia, and it was ultimately deemed to be ineffective for that purpose, but it was rebranded as an anxiolytic medication for anxiety disorders. So most people are aware of Buspirone as a medication to treat generalized anxiety disorder. What makes Buspar interesting is it has a favorable side effect profile, and that's in relation to even the SSRIs, which are commonly prescribed for the use in generalized anxiety disorder. It also has a lack of abuse potential, which is common with medications like benzodiazepines, which we've discussed extensively elsewhere. So let's talk about the FDA approval as well as off-label uses of Buspar. So FDA approval is for generalized anxiety disorder, but it is often used as an adjunctive therapy in major depressive disorder. You often see clinicians or psychiatrists adding this medication to somebody who's already on another SSRI, say Lexapro, for example. The off-label uses that come to mind, one that's very, very popular use in psychiatry, is it's used as an augmentation agent for the treatment of sexual side effects associated with SSRIs. So there's no risk for dependence or withdrawal, and the only problem with this medication, like I said before, favorable side effect profile, no risk for abuse potential. The problem is it still takes a long time to work. So for a patient to start to develop relief from their anxiety, it takes 2 to 4 weeks to achieve the maximum effect. So there's a delay there in how fast this medication can work. All right, so let's discuss the mechanism of action a little bit. Now, the primary mechanism of action by which this medication works is called 5-HT1A, so serotonin 1A receptor partial agonist activity. Now, this is, again, a common theme in most of psychiatry. Many of the videos I've talked about this idea of partial agonist activity. So it also, though, has weak activity at other serotonin receptors, specifically 5-HT2A, 2B, and 2C receptors, as well as 5-HT6 and 7 receptors. So there's other serotonin receptors where there's weak affinity. However, there is still some activity there, and it could be partially responsible for the effects on anxiety as well as depression. It also acts, and this is going to explain why this was originally thought of as an antipsychotic medication or originally developed to be an antipsychotic medication. So it actually is a weak antagonist or blocker of dopamine D2 receptors. So dopamine D2 receptor blockade is the primary way that we treat positive symptoms of schizophrenia and other psychotic disorders. So it's no surprise that they looked at this medication as a potential antipsychotic medication. And again, with low D2 receptor activity, what you're going to find is lower risk for things like EPS. And there's also a metabolite of this medication that's called 1-PP, and this 1-PP metabolite is an alpha-2 an antagonist. So it's an alpha-2 antagonist, and that may also play a role in its anti-anxiety as well as antidepressant effects. Now, why does 5-HT1A partial agonism produce relief of anxiety? No one really knows. What the theory is that increased serotonergic activity in the amygdala, as well as the anxiety and fear response circuits of the brain, results, of course, in reduced anxiety. Now, the delayed response of the medication is due to adaptation of the 5-HT1A receptors. This takes more time to occur, and that's why there's a delay of 2 to 4 weeks in terms of treatment response. So how do we dose this medication to effectively treat generalized anxiety disorder? The dose is generally 15 milligrams per day, and that can be given either as 7.5 milligrams twice a day or 5 milligrams 3 times a day. I'm a big believer that less medication administration throughout the day is easier for patients to follow, so I tend to prefer BID dosing over TID dosing, but either way you go isn't necessarily going to be wrong. Now, every 2 to 3 days, you can increase the dose by 5 milligrams until the desired response is achieved and you reach or you reach a maximum dose of 60 milligrams per day. So every 2 to 3 days, bump it by 5 milligrams, and hopefully you're achieving the clinical response you're looking for before you reach 60 milligrams total. The most common therapeutic range will be somewhere between 20 and 30 milligrams per day. So to complete the video, I'm just going to give a couple of other little pointers about dosing the medication and using this medication. So the medication can be taken with or without food. It does not matter. It's up to you as the patient, really, what you want to do as far as eating or not eating with the medication. It's metabolized by cytochrome P450-3A4, so obviously anything that induces or inhibits 3A4 could affect the metabolism of this medication, leading to either increased or decreased plasma levels. Adverse effects are always important to talk about, so the most common one, and the one that's above 10% of patients, or more than 10% of patients will experience, is dizziness. So dizziness is the more common one, and more than 10% of patients may experience this side effect. Now, in 1 to 10%, so this is people less than 10% of patients, can experience other side effects that include things like abnormal dreams, ataxia, confusion, drowsiness, excitement, headache, nervousness, blurred vision, ringing in their ears, nasal congestion, sweating, diarrhea, nausea, tremor, weakness, and elevated liver enzymes in very rare cases. So it's a lot of different side effects, but again, this is occurring in less than 10% of patients taking the medication. The only one that occurs in more than 10% is dizziness. Buspirone has its place and its benefits, and primarily the way I use it is as an adjunct to other medications like SSRIs when somebody is experiencing sexual side effects. I have used it as a standalone medication in generalized anxiety disorder, but clinically, from my experience, I don't think it's the greatest medication for generalized anxiety disorder, and I don't know if it has the efficacy that I would need to treat a patient with severe anxiety. It can also be used in conjunction with the SSRIs and SNRIs for jaw clenching or teeth grinding, also known as bruxism. So somebody who develops teeth grinding or jaw clenching from SSRIs or SNRIs, you can use this medication to treat those side effects. In very, very rare cases, it can cause akathisia, and that's because I said at the beginning it was marketed initially or thought to be developed as an antipsychotic, and it does have some D2 blockade, although not very much. So I'm going to hold the video there. I'd be happy to take your comments and questions below, and please, like I said, like and subscribe to my channel. It helps me to keep growing this channel and helps me to know what the next videos should be.